Hi, and welcome to the Health for Life podcast for those who want to build strong trucks and strong bodies. This is Kevin Muniz and Trisha Foley, your wellness team, bringing you practical tips and tricks to improve your health.
Hey, everybody. Thanks for listening in. We are excited to have another guest today, my coworker, Ellen Marshall, who is a doctor of physical therapy and Volvo's own physical therapist.
Yes, Ellen, we are super excited to have you today. And since it's National Arthritis Month, Ellen is going to be sharing some really good information on how to manage arthritis and treatment options.
Yeah, and she is going to help us all out with addressing common pain issues and safe things that you can do to help with pain. So, welcome, Ellen.
Hi, friends. I'm glad or excited to be here.
So we are so excited to have you here, and the timing couldn't be more perfect with it being National Arthritis Month. I think I saw a statistic recently that 54.4 million adults suffer from arthritis. So that sounds like a big problem. So can you tell us a little bit about what people should know when it comes to working through the discomfort versus seeking medical care?
Absolutely. That is a great question. Arthritis itself just means inflammation of the joint. It can be caused from multiple things, but the most common form is osteoarthritis caused by the deterioration of the joint. Thank you, gravity. Typically, the weight-bearing joints are most affected, such as the knee and hip being the most common. Although osteoarthritis cannot be reversed, it can often be treated through the symptoms, most effectively managed through conservative approaches like exercise and physical therapist treatments. The most important thing to remember is that exercise shouldn't hurt. Minor aches and soreness is common when trying new things, but if you experience any sharp pain or notice any bruising or swelling following exercise, you need to seek medical care.
Yeah, this is really important. So many people just try to push through that pain, and unfortunately, they end up worse off. So, your body really is your best guide, and it's going to tell you in the form of pain or sensations what's working and what's not. We just need to listen, right?
Yes, it's really key, and so is prevention and management. Exercise is one of the best ways to improve pain, stiffness, and decreased range of motion, which are common symptoms of arthritis. In addition, regular physical therapy can help, or physical activity, can help benefit your physical, mental, and social health, and prevent or improve many chronic conditions such as heart disease, diabetes, obesity, depression, and some cancers. The trick is doing the right exercises in the right way and at the right time. Physical therapists help patients understand arthritis and its complications. We provide treatments to reduce pain and improve movement and offer education about obesity and healthy life choices.
Not knowing the right steps can really feel overwhelming for folks. And having you, Ellen, on site is key to the issues that can be addressed right away and get people back on their feet.
It isn't easy. Arthritis is a very complicated condition, but once arthritis moves into the joint, the muscles surrounding the joint become weak. This leads to a ripple effect of joint pain and muscle weakness because of your body's muscles and joints are all connected.
Okay, so it sounds like catching it early can really help. When would you recommend that someone consider physical therapy?
If you've tried to exercise and stopped because of pain, consider working with a physical therapist who can work with you to develop a customized, safe, and effective strengthening and conditioning program that helps reduce your pain, not add to it. And also can help improve mobility and function. That's right, remember, exercise shouldn't hurt even if you have arthritis. Generally, people with arthritis need to increase their exercise routines more gradually than someone without it. Again, a physical therapist will partner with you to develop a program tailored specifically to your level of function and your goals. Walking, cycling, and swimming are great forms of cardiovascular exercise, but strength training and stretching are equally important. The trick is to perform these exercises with the right form and posture and for the right time and intensity.
So it sounds like motion is the lotion, where we need to continue moving, but we just need to make sure that we're doing it not too hard and not too fast. So this is some really great information. Now, we all know that building trucks puts a certain physical demand on the body. So Ellen, what do you see the most as far as problem areas on the body that are unrelated to arthritis?
Great question. Most common pain issues I normally see are shoulders, knees, and definitely lots of back pain. However, I also tend to see a lot of foot and hand issues due to the workout ball, though.
Yeah, that makes sense. I think of the steel-toed shoes, which are really necessary for safety, but can also be really rough on the feet too. I'm curious if you have any tips on things that can help them address those common pain issues.
Yes, again, the most important tip is always listen to your body. If your body constantly aches or you seem to have some pain that just won't go away, don't wait. Come by for some treatment. Whereas medications like opioids only mask the sensation of pain, physical therapy can help treat that pain and improve your quality of life through movement, hands-on care, exercise, and patient education. The second most important tip is move it or lose it. Our bodies aren't meant to do one thing over and over again. Just by adding some simple stretches or going on a small walk can greatly change how your body feels.
So you are preaching to our choir here. So these are some great tips and strategies. I'm sure we may have a few listeners that are still feeling a little on the fence about talking to a PT. What would you like to share to debunk some of the things that people may have heard about physical therapy?
Yeah, definitely. There's several myths that I hear a lot. Those myths are PT is just about exercise. If it doesn't hurt, you're not doing it correct. Anyone can perform physical therapy. Surgery is my only option. I can do physical therapy myself. And physical therapy is just for injuries. So let me tell you a little bit about those. First, many people think PT is just about exercise. Exercise is only a small part of what we do. I'm a manual therapist, which means most of the session involves me putting my hands on the problem areas through massage and joint mobilization. Another myth is if it doesn't hurt, you're not doing it correctly. PT exercises shouldn't cause pain. Again, if you're having pain with exercising, the exercise should be modified, which requires the skills of a physical therapist. Also, physical therapy can only be performed by a licensed physical therapist. Many physical therapists have additional training and are doctorates, such as specific areas like neurology, orthopedics, sports, or women's health. Another very common myth I often hear is surgery is my only option. In many cases, physical therapy has been shown to be just as effective as surgery in treating a wide range of conditions, from rotator cuff tears, degenerative disc disease, to meniscus tears, and some forms of osteoarthritis. Another thing people often say is, I can do physical therapy myself. Although your participation is key to a successful treatment plan, every patient still needs the expert care and guidance of a licensed physical therapist. Your therapist will leverage his or her specialized education, clinical expertise, and the latest available evidence to evaluate your needs and make a diagnosis before creating an individualized plan of care. And lastly, many people think physical therapy is only for injuries or accidents. Physical therapists do a lot more than just stretch or strengthen weak muscles after injury or surgery. They are skilled at evaluating and diagnosing potential problems before they lead to more serious injuries or disabling conditions, such as carpal tunnel syndrome, frozen shoulder, chronic headaches, low back pain, and those are just to name a few.
Wow. That's a lot of really good information. It's great to hear that physical therapy can provide low risk alternatives to medication and surgery. So thank you so much, Ellen. Before we tie things up today, can you remind everyone where you're located and your office hours so they know where to find you?
Absolutely. I am located on site Monday, Wednesday, and Thursday, just down from the pharmacy, and take appointments from 7 a.m. to 6 p.m., although we are closed 1 to 2 for lunch. You can schedule using the Care Here app or by calling our customer service support line at 877-423-1330.
Yes, please take advantage of Ellen's services and expertise. Her services are available at a very affordable price compared to what you might pay outside of Volvo to see a physical therapist. Generally, it's a $5 copay, right, Ellen?
Yes, that's correct. For most Volvo insurances, it only costs $5 per session. You do not need a referral to come see me also. However, I do accept all referrals from the Care Here doctors as well as any outside providers. And remember, I treat patients from all ages, from 2 years old up to 100 and plus. Just stop by the clinic and I'm happy to help you get scheduled for evaluation.
Yeah, you offer such a great service. We hope now that more people know who you are and what you do. And for questions on physical therapy or nutrition and health, reach out to any of us. Ellen, what is your email?
Yeah, my email, you can reach me at emueller@carehere.com.
Awesome. And if you need anything from Kevin or I can be reached at tfoley@carehere.com. And Kevin?
As at kevin.munez@consultant.volvo.com. Thanks for listening in, everybody.
Bye.
Bye.